sharing and applying knowledge necessary for health system strengthening. It has a membership of more than 1,600 members in over 110 countries, and then regional networks provide opportunities to interact and share knowledge with peers at the regional and country level. This convening is an initiative of the HSG Africa Regional Network, and this is the link to the HSG Africa Regional Network. Just to mention that the Systems Development Initiative is an organization that is collaborating with HSG to bring these convenings to us. It was founded in 2020 and is a platform dedicated to promoting evidence-informed health and development policies in Nigeria and beyond. And on the screen, you can see the members of the Systems Development Initiative who are the convening organizers. We have some organizations that are also collaborating with us on this convening. We have NISA. NISA is the Nigerian Implementation Science Alliance. It started as a collaboration among United States PEPFAR-supported implementing partners, research universities, and policymakers to enhance the quality of healthcare through implementation science and research. You can visit their website to get more information about NISA. And then we also have HERFON. HERFON is Health Reform Foundation of Nigeria, a non-profit organization dedicated to addressing and improving poor health indices in Nigeria. The website is also on the screen. You can also visit the website to get more information about them. As a brief overview, the aim of the convening is to engage and connect key audiences, share insights, collaborate, and problem solve together to drive improved and strengthen capacities for HPSR leadership in Nigeria. We also aim to identify gaps, opportunities, advocacy strategies, and relevant stakeholders for increasing participatory leadership for HPSR at national and subnational levels in Nigeria. Thank you very much. So by way of brief introduction, I'll be introducing the panelists we have for today's session. We have with us Dr. Cheluchi Onyemelukwe, the managing partner at Health Ethics and Law Consulting, which provides cutting-edge advisory on a wide range of legal, regulatory, and policy issues in life sciences, health, gender, social protection, and development sectors. He's also an associate professor at Babcock University School of Law and a leading expert in health law in Nigeria. He works extensively in the social sector with health systems law and policy, gender, child protection, research ethics, migration. He consults for international development organizations such as World Bank, the World Health Organization, IOM, to mention a few. Our public health law work has included regulatory support for Nigeria during COVID and an in-depth assessment into Nigeria's legal framework. He holds a doctorate degree in law from Dalhousie University, Canada, and a first-class degree in law from the University of Nigeria. He's a member of Nigeria's National Health Research Ethics Committee, an author. Dr. Gafar Alawode is an experienced public health practitioner and a seasoned program manager. He obtained a master's degree in tropical medicine from the prestigious Liverpool School of Tropical Medicine after acquiring a first degree in medicine and surgery in Nigeria. He has managed several donor-funded development projects at senior levels in Nigeria and other developing countries. He was engaged by Merlin as the project coordinator for DFID-funded MCH and primary health care projects in Liberia. He also managed ECHO and DPRM-funded health system strengthening projects and HIV/TB projects in his capacity as health coordinator for International Rescue Committee. He's the team leader for the Kaduna State team of a multi-million-dollar DFID partnership for health, the Part 2 project. Dr. Chinyere Mbachu obtained her MBBS degree from the University of Nigeria, Nsukka. She's a community health physician at the same institution and has worked as a consultant with the Federal Teaching Hospital at Abakaliki for 3 years. She's currently a lecturer at the University of Nigeria, the College of Medicine, University of Nigeria, Enugu campus. Her career contributions have focused on applying knowledge and skills in building the field of health policy and systems research in Nigeria, and building the capacity of policymakers and practitioners in the use of evidence for policy making and practice. She also trains undergraduate and postgraduate medical doctors in community health. She participated in developing the curriculum for Introduction to Complex Health Systems, available on the CHPSR website. She's currently a member of the Association of Public Health Physicians in Nigeria and the West African Network of Emerging Leaders in the Resist Consortium. Prof. Echezona Ezeanolue is the Vice President for Innovation, Healthy Sunrise Foundation, and Professor of Pediatrics and Public Health at the University of Nigeria. A clinical epidemiologist, his research focuses on the use of implementation science to enhance the effectiveness and quality of health services. He served as the director of the HRSA-funded Comprehensive Maternal Child HIV program in Nevada, and has been a PI in multiple NIH-funded grants, including the community-based baby shower trials that seek to identify feasible, acceptable, and sustainable approaches to test, engage, and retain individuals with HIV infection to achieve viral suppression and improve health outcomes. Ezeanolue has been recognized as the Nevada Public Health Leader of the Year, Nevada Healthcare Hero, and then the AAP Local Hero for his contributions to public health. Finally, I'll introduce our lead panelist, who is Professor Obinna Onwujekwe. He's currently the Director of Research at the University of Nigeria and the coordinator of the Health Policy Research Group. He earned his medical degree from the University of Nigeria Enugu campus and later received a diploma in public health and policy from the London School of Hygiene and Tropical Medicine. He also earned a PhD in health economics from the same school. His expertise includes health technology, health policy and systems research, economic evaluation, equity analysis, healthcare financing, and public health economics. He's currently a professor of health and policy and pharmacoeconomics and pharmacoepidemiology at the University of Nigeria and is the editor of the African Journal of Health Economics. Ladies and gentlemen, I ask that you join me to welcome these seasoned panelists, and we hope that today's session will be a very fruitful and interactive one. Thank you.
Hello, are we ready?
Yes, sir, we're ready. Welcome, sir.
Yeah, but I can't share my screen. I need to share screen. It's disabled.
Okay, sir.
Can you enable share screen, please?
Yes, we're working on that now, sir.
You can share your screen now.
Okay.
Hey, Prof, we can see your screen already.
Pardon? No, it's I think I'm sharing the wrong screen. So I try to get out from this one. All right, so is he okay now?
Yes, sir, it is.
You can see, yes.
Hello? All right,
Yes, Prof.
sounds
It's okay.
fine, thank you. So you can see it. Yeah, so I think by way of introducing this session, I've titled it Getting HPSR Research into Policy and Practice, Collapsing the Thick Wall Between Researchers and Policymakers. As we know, evidence-based decision-making is widely used in developed countries and is now being used in many developing countries to inform more effective, efficient, and equitable decision-making and strengthen the health system.
Uh-oh.
We are sorry for the technical issues that we are experiencing this evening. Prof will shortly join back now. Please bear with us. Okay, we are happy to inform everyone that Professor Obinna is back, and we hopefully hope that the network will be friendly with us this evening. Please enjoy the rest of the session as we proceed now. Thank you.
Okay, so I'm sorry about that. It was due to weather. So I think continue. So this was where I was. So I think the important thing to note is that many countries they've developed frameworks for generating and using evidence for decision making. You know, including many countries in the low and middle income countries. I mean, we've had a lot of experience with that. But and these days, what we call faith-based, you know, it's work. You know, let's try. You know, such decision making are frowned at. We can see from the recent current COVID responses, all faith-based decision and policy making are frowned at. You know, everything has to be informed by evidence. So that's what we call getting research into policy and practice. So it's a process of going from research, evidence to decisions, and then evidence-informed policies. You know, it is a complex interplay between evidence and policy processes. You know, sometimes it's also political. And then in Nigeria, you know, to integrate research findings into policy, you know, and communicating research findings to Nigerian policymakers, as most of us know, is a key challenge. So why is health policy and system research? Why is it very important to inform decision making in the Nigerian health sector? I think, you know, why is it hardly used to inform decision making? Well, I think first of all, there's ignorance of available evidence. Many decision makers don't know the evidence that exists. And sometimes, even when the decision makers know that there's some evidence, they don't have the technical capacity to distill and use such evidence for policy making. I think we've also identified that there's a weak capacity by researchers themselves to conduct good health policy and systems research and generate useful information. You know, so there's always this gap between researchers and policymakers. But I think also very important, you know, every Minister of Health at the federal state level, they have Department of Planning, Research and Statistics, but the research is comatose in all of them. You know, you hardly hear what are they doing about research. Yes, they do planning, they do statistics. So the R is the problem. So, so other barriers to use of research, you know, political and ideological factors, it comes in, even religious factors, policy and scientific uncertainties, where we are thinking about asking how relevant is the research findings to a particular policy context, different conceptions of risk, timing. Sometimes we can't conclude the research, but what it's supposed to inform has already passed. The reputation of the researchers is also important. I mean, if researchers that have produced the evidence are known to people who are into plagiarism or they don't have good reputation, whatever they produce will not be used. And then of course, environment without research culture, where there's no motivation to appraise research findings. So the two communities model of researchers and policymakers. So you have university researchers on one side, you have government officials. Their attitude to research are different. For us, university researchers, that attitude to research is justified by its contribution to knowledge, research findings lead to further investigation. And then government officials say that only one of many inputs to their work. That's the research. That's they just feel is one of the input to their work. justified in its relevance and practical utility. Accountability, university researchers accountable to their peers primarily, but also to funders. But while government officials are accountable to politicians, but also to public indirectly. And then the priorities, expansion of research opportunities and influence of experts in the world is what propels university researchers. While for government, is maintaining a system of good governance and satisfying politicians. So you see, so this also brings some conflict. So this is from Hughes et al. 2004. So what are the some adverse effects of non-use of health policy and system research evidence for decision making in Nigeria? We know the Nigerian health system is very weak. And I keep saying it's because we are not using evidence from health policy and system research for decision making. All our building blocks are weak. Even the health system softwares are weak. I don't know anyone that is healthy. And because of this, again, we have too much of focus on biomedical evidence. And we neglected health policy and system research, using the evidence for policy making. And because of that, Nigeria did not achieve any health-related MDG targets, none. And then we are making wobbly moves on the path to achieve health-related SDGs, especially universal health coverage. It's going to be a miracle, eighth wonder of the world, if we're able to achieve the health-related SDGs, especially USC, if we don't start generating a lot of relevant health policy and system research evidence and using such for decision making to strengthen out the building blocks and all that. So what can we do to enhance the use of health policy and system research evidence for decision making and policy making in Nigeria? I think it's recognized that if policymakers don't understand what we're talking about, they'll never use it. So I think we need to build the capacity of decision makers or policymakers to understand the principles and usefulness of health policy and system research. We can't just take it for granted that they know. We know that capacity is not there. And then we also need to build the capacity of the researchers to understand the principles and usefulness of health policy and system research, to be able to undertake useful and relevant research. Number three, I think we need to develop frameworks within ministries, departments, and agencies, and the private sector on how to harness and use this evidence. It's quite important. Then, how do we bridge the conversational gap between the policymakers and the researchers? We've seen they have different motivations for them. And then we need to strengthen the research aspects in Department of Planning, Research, and Statistics, and definitely create policy liaison units, what we call policy liaison units in all ministries, that will harness this evidence and send the evidence to the relevant NDAs for them to use for decision making. And then government should fund health policy and system research. It's not we talk about it and then we're looking for a donor to come and fund, and donors fund according to their own interests and priorities. It may not be according to the interests and priorities of the country. So the four GRIP strategies, GRIP, remember, is getting research into policy and practice, that we usually use within our research group, health policy research group. Sometimes the researchers can initiate empirical research and then actively disseminate the research findings to relevant stakeholders and policymakers. That can happen. And then this active dissemination can lead to using research findings for policy and practice. Sometimes you can also have policymakers initiated empirical research, and the policymakers who are seeking evidence from researchers. And then this also sometimes involves stakeholders in developing the research objectives and participating throughout the research. Or the third one, or the projects can just be to address GRIP. We need this evidence to get into policy and practice. So what happened? So this kind of project, facilitates policy maker researcher engagement in best ways of using research findings to influence policy and practice. So this strategy 3 is something we've done in Lagos State, we've done in Enugu State and Anambra State, and we found out that they work. So I'll jump this one, and then so 2 practical examples of developing institutionalized frameworks on health policy and system research for GRIP. So my research group, so we implemented in about 2010 to 2012 in Lagos State a project called Policy Research Evidence for Effective Working of the Health Systems, preview project in Lagos, which was a collaboration between the Nigerian Academy of Science and the Lagos State Ministry of Health, which was directed at stimulating the culture of policy pronouncements which are based on evidences from research. So we implemented it for Nigerian Academy of Science, and then within that project, we took those steps I mentioned initially, building capacity of the policymakers to understand health policy and system research and the usefulness of evidence-based policymaking, and creating frameworks within the Lagos State Ministry of Health on the use of evidence for decision making. And then we found out that it worked. You know, as at that time, we haven't evaluated after a long time. But that project that was a GRIP project, you know, helped to improve. I think because of that project, a policy liaison unit was created in the Ministry of Health in Lagos State. And I think they're now using more evidence for decision making. And then just recently, we also implemented another project in Anambra and Enugu State, you know, on building capacity on health policy and system research and getting research into policy and practice, focusing on the ministries of health in the state, researchers and other key stakeholders. You know, we implemented a series of workshops and supervisory engagements. And then we found out it's also, I mean, the awareness about health policy and system research was created. The awareness about the use of such evidence for health policy and system research was created. And then units were created, and they actually started getting evidence and using evidence for some of the things they do. So so these 2 projects, I mean, mentioned the objectives. Well, did they work? We think yes, to a moderate extent, because we haven't got to evaluate after a long time. But our short-term evaluation showed that those interventions work. So I think as we discuss about the use of health policy and system research, we need to also know how to balance technical processes with social relations in getting research into policy and practice. Because research to policy processes are fundamentally social. Stakeholder engagement is the foundation, and trust is everything. So researchers, important thing here is that researchers should be able to understand the mind of the policymakers. And sometimes it's even good when some researchers become policymakers. Well, don't see them as that their minds and what drives them and their policymaking space. So I'm finishing. So the key enablers of using health policy and system research findings to get them into evidence, into policy and practice. Credibility of researchers matters. Social and interactive skills. If you have embedded researchers, within the ministries of health, within agencies, it also helps. Personality of researcher is very important. You have to be able to reach out, make friends, and be interactive. Don't be a hermit. If you hide under your bed in your room, you know, you can't get research into policy and practice. Understand and respond to the politics. Who presents, you know, the best timing. And then linkages to academic social forum. Mentorship is very important, and integrated knowledge translation. So the challenges and recommendations for using health policy and system research evidence for policy and practice. I think capacity to use, I've mentioned it in the beginning, capacity to use health policy and system research evidence. So the solution is to build capacity within the research process to access and apply evidence, then there's always a communication gap between researchers and donors and policymakers. Policy dialogue is quite important as a solution. Then managing the political process of getting research into policy and practice, we need to build the interest of researchers in actually, active getting research into policy and practice. And then there's also lack of willingness of some policymakers to use research. I think we need to engage closely with policy briefs to make them to change their minds and become become research friendly. So in conclusion, getting research into policy and practice with health policy and system research evidence, it requires a deep understanding of how to interact with policymakers, what information and activities they require, in what form and with whom to establish interactions. It's also very important to educate, I keep stressing this point, educate decision makers and practitioners on the relevance of produced evidence and how to utilize findings. Interpersonal relationships and trust are key to strengthening the relationship between the researcher, policymakers, and practitioners. So thank you. That's a long and introductory presentation, but I'll now hand over to the moderator to guide us further on what next to do. So thank you.
Thank you very much, Prof. And we welcome our moderator, Felix Obi, to take over the session. Thank you.
Okay. Thank you, Prof, for that opening section. And I will, we have the panelists on ground. So I'll just go straight to some of the questions that we have for them today. I'll first of all start with Dr. Gafar. Dr. Gafar, I hope you are around.
Yes, I am, Felix.
Okay, great. At least you've seen the framework that Professor Obinna shared with us. So one thing I wanted to ask is, if you wouldn't mind helping us sort of give some clarity on what sort of strategy do you think we should put in place to ensure that research provides the needed evidence for policy formulation, especially within our context I'm not just saying Nigeria alone, but across Africa and low and middle income countries, where recall that Professor Obinna in his presentation, he said that the Planning, Research and Statistics division or department in most government ministries, the R component is usually inactive compared to the policy and the statistics. So maybe you could just respond to that, or some key strategies that you think can work.
Okay, thank you very much, Felix, and thank you, Prof. And I would like to thank the organizers of this very, very important webinar, and thanks the participants as well. So Prof did a justice to the question you are asking me. I think I would just be saying more of the how of what, because the Prof has laid out what in terms of what we need to do, but how of it I think is very, very important as well. See, one thing that resonates clearly from the Prof submission is that we really need to build trust and relationship between the researchers and the policymakers, and it's like a market. Just like in any market, there's a supply and demand aspect of it, and once there's a disconnect between the supply and demand, that a market collapses. So in terms of what we need to do to build relationship and build trust, I think relationship and trust we are talking about is something that should be enduring in terms of looking at structure that will bring researcher and policy together on constant basis. where they will continue to look at the issues. Prof mentioned something about ignorance on the part of the policymaker, that they don't know that some researches evidence are actually available. But it's equally true for researchers as well. There are a lot of researchers that actually don't know much about the policy environment in which they are supposed to do researching. So in terms of how do we build that relationship, we can have like a sort of a standing technical working group. Now, technology has made things a lot easier. We can have online platform where the policymakers and researchers from key institutions who says all the Director of Plan Research and Statistics of 36 states and FCT cannot be on the same platform with policymakers in Nigeria. We can do that kind of a thing where they'll continue to rub mind. And specifically, what do they need to do to cement that relationship? It is very, very important to have a clear learning agenda or research agenda, where the policymakers will be able to highlight, these are the key policy issues I'm actually facing. And this is where there is evidence gap. And the researcher will take it on and say, okay, if these are your priorities, how do we frame the research questions? What is the methodology? Where would the resource come from? So that, when we have this learning agenda, it is going to, and it could be learning agenda at the national level, at the state level, for specific program area to develop this. And the advantage of this is that if you have a learning agenda, it's not going to be only useful locally. Even academic institutions abroad that want to do research in Nigeria can key into it. There are a lot of things happening. There are a lot of research work happening in academic institutions. There are a lot of people studying in Liverpool, in London, in Harvard, that they are coming to Nigeria to do research. But if we have this clear framework, everybody will key into it, and we'll be able to harness and align those research findings towards a policy framework. And another important thing we need to do, we need to raise the accountability bar for use of research finding into policy. And how do I mean? We have, other actors need to play a role. Civil society needs to play a role. The media needs to play a role. Legislature needs to play a role in terms of key. If we are able to harness key research findings and raise accountability by the civil society, will be able to tell the policymakers that what you are doing is not in line with the available policy, because they know. The media will be able to hold policymakers accountable that there is this evidence, what you are doing is not in line with the available evidence. And the lawmaker will be able to scrutinize the policy of the policymakers based on the available evidence. So we have to raise the accountability bar. And part of the way to raise the accountability bar is to sensitize this other group of people. We should not be looking at only the policymaker and researcher. We should extend this agenda to the civil society, to the media, and to the legislature. One other important area is in the area of the political economy that Prof talked about earlier on. Policy-making process is more political than technical. So even when you have a technical evidence, it might not necessarily translate to policy. And when it translates to policy, it might not make its way into practice, because, when we're talking about research into policy and practice, we don't tend to emphasize the practice aspect of it. It can enter the policy and remains at the level of the policy document. What of the practice aspect of it? So it is very, very important for us to consider, as we do research, as a policy research, we should look at the political economy as well. What is the influence and interest of key actors and institutions? How do we frame research finding? Communicate research finding, because it's very important. There's a way you communicate research finding that might be offensive to very, very powerful people. And there's a way you communicate it that they might be receptive to it. So we should look at the issue of political economy as well, build the capacity of researchers on political economy, including policy actors as well. So when we are talking about building capacity, it's not only about in the research methodology, but in terms of the understanding the political economy as well. Probably one last thing I would like to say is that when we are talking about research into policy and practice, we should know that the whole process is an iterative process. It's not a one-off process. So it is very, very important for us to, even when we conduct research, we see the findings midway into policy, it doesn't end there. We need to continue to probe into when it gets to the practice, what are the issues, what do we need to do differently. I think, and then finally, we need more of operational and implementation research, because those are very, very critical in terms of getting for policy making and for implementation as well. So I would like to pause here for now, and probably
Okay.
there are other things that I need to contribute to. Thank you.
Thanks, Dr. Gafar, for that. And so I know we've covered a couple of things, but I want to bring on Professor Eche, who has a lot of experience in this area. So, Prof, Gafar has spoke about capacity building and in health systems and policy research. But over the years, your group, NISTA, has been doing that. Health Policy Research Group have already been doing a lot. There have been a lot of capacity building and all of that. But we still know that aside of challenges of funding, what are the other issues that, from your experience, may be leading to this issue of the production of research evidence? And aside of all the challenge, it will also be important for you to also highlight some opportunities that we can leverage on to produce more research for improving health policy and practice. Over to you, Prof.
Thank you so much, for the opportunity to speak, and for the people who spoke before me. They've laid a very good ground in terms of what we are supposed to discuss during this meeting. I'll pay special attention to the question that you asked me, and which is to say, despite all the years we've spent on this capacity building, why do we still not where we want to be? And for a while, at the Nigerian Implementation Science Alliance, we were thinking about this and saying, what is missing? One of the things we noticed, there's a lot of people who are implementing partners. And one of the things we've noticed that as the year go by, these are people who had an MD degree, so they have their MBBS. And the next thing we see, they have their master's. And the next thing we see, they have a PhD. And we are still not where we want to be. Despite all of this capacity they have acquired. So one of the things, I remember being at a meeting in Enugu for the Public Health Association, and it occurred to me to ask one question. So I asked about 200 people in the meeting. So I asked, I said everybody to stand up. And I said, if you have a terminal degree, which means you have an MBBS or you have a PhD, that you keep standing. And if you don't have one, you should sit down. Maybe about 20, 25, people sat down. So the rest of them had a terminal degree, which means they have MDs, MBBS, or they have a PhD. And I said, these are people who have a terminal degree, have some already training in them. So I wanted to look at a specific thing. I said, if you've been taught how to do systematic review of the literature, that you should keep standing. If you have not been taught how to do it, you should sit down. So about 50 sat down, about 150 people were still standing up at the time. So I said, so these are the people who have the capacity to do systematic reviews of the literature, to produce the evidence, because this evidence we're talking about is not from one research in Enugu, or one research in Lagos, or one research in Ibadan, or one research in Jos. It's the being able to synthesize this and be able to produce that evidence for the policymakers to use. Nigeria is a very diverse community. So when I asked them, so 150 of you have done that, doing their PhD, doing their masters of how to do a systematic review. And I said, if you have completed and published a systematic review, keep standing. And if you have not, sit down. Only 2 people were standing. What it did tell me is the difference between capacity development and skill development. And that is the fact that one of the things we have challenges in Nigeria is that people leave Nigeria to go and do their masters, to go and do their PhD. They come back, they go to the job they were doing. They try to carve out a new area for this capacity and skill they have acquired, and then they are swallowed by the system, and they end up doing what they were doing before they left, and those PhD and masters become alphabet after their names. So you ask me, how can we change that? And some of the things we think we should do. And there is no one single bullet that solves these things, but there is a way to think about them. So when I got to the US about 25 years ago, there's a couple of things I noticed that was different from my own training. I trained at the University of Nigeria, which by the way, was a very good training that I got. When I went there, I found out that I had no problem being able as a doctor to do an LP, to put an insert an IV line, do everything that a doctor is supposed to do. There was something that I wasn't taught. I wasn't taught about the science in terms of research of how to look at evidence and how to interpret those evidence. I could do the doctor work. So that was one area that I decided, you know what, I don't think I'm gonna learn much of medicine coming to the US, but I can learn something I didn't know, and that was research and how evidence are generated. So one of the things I noticed when people do their PhDs in the US or in any other country, after the PhD, there is a position where they have a postdoc. Why do people do a postdoc? A 1 year or 2 years or 3 years after they finish their PhD. This is the place to know that after PhD, there is a practical aspect that people want to be able to do, which means they want to be able to take that practical experience, the theoretical experience, and under the quarter of a mentor, be able to put that into practice. So you've learned how to do a systematic review. You've learned that all in the class. How do you now take that systematic review and do one under the guidance of a supervisor or the guidance of a mentor who can now take the theory of it and do into practice? That is something that we're missing. So when people go to do their PhD and come back to Nigeria, there is no space for a postdoc position in our institutions. It's not funded because they have to come there either as employees of the federal government, of a lecturer, assistant lecturer, professor, and all of that. But if they wanted to spend a year or 2 years as a postdoc, there is not something like that. And that is something that we started thinking about the Nigerian Implementation Science Alliance to establish. So we're working on that in a way that they don't actually have to do their postdoc just in universities. They can actually do it in the policy making. So if somebody finish their PhD and come back, can they spend a year as postdoc in the Ministry of Health, in the Nigerian Primary Care Agency, in NCDC, in the NACA, in any of these agencies? Can they spend their 1 year postdoc after they come back in that area? Is there things like that that allows them to now take those theoretical capacity and turn them into skill? So I want to be able to stop here, so I make sure that I have time for you to ask some other questions. But to me, I think there is still a deficit between what we call capacity and what we should have, which is skill. And I wanted to use this systematic review as a way to demonstrate, and you can apply that to so many other things, to demonstrate, to see why I think there is still that missing gap, the final stage of that, which is we have that capacity, how do we turn it into a skill? And one of the ways I think we can do it is through mentorship. If you go to London and finish your PhD in health economics, think about what it would do to you spending a year with Prof. Onwujekwe in health economics and doing one project for the Nigerian system. And that actually defines your capacity into skill. I'll stop here.
All right, thanks, Prof. That was, thanks for that. And if we even drop a question in the chat box to ask how many of the participants can do systematic review, maybe that may be just a quick short poll. Maybe if you can do systematic review or the meta reviews, possibly you can just let us know, just on the side, by the way. Thank you so much. And Prof, just to confirm, Prof has really been involved in a lot of capacity building. And last year, just to also acknowledge him publicly, we worked with him to work to do capacity building, like a pre-conference workshop at in Accra, African Health Economics Association. And it was one of the best capacity building sections we had. Now, I would want to go to Chinyere Mbachu, who has also been working on this field. And I know you've had a lot of engagements with policymakers. So one thing I would like to know, like from your experience, of course, speaking from the context of Nigeria, what are the entry points for actions for people who work in health policy and systems research, especially policymakers and researchers, in the sense of what entry points can we use to strengthen the generation of more customer or policy-focused research in Nigeria? So, yeah, please go ahead.
Yeah, thank you very much, Felix, for that question. And I mean, the other panelists have also mentioned or highlighted some entry points maybe not consciously through their discussions and presentations and all of that, but I will just want to highlight some that I think are relevant for researchers, then some that are relevant to policymakers, and then for both researchers and policymakers. So like when Professor Onwujekwe, the lead panelist, when he was making his presentation, he said something that a researcher who wants to influence policy and practice cannot be a hermit. I mean, so you can't sit in your house, I can't sit in my room and be doing some research and hoping that it will influence policy at some point. So I need to get on board with what is currently happening. So in the health sector, what reforms are already taking place, for instance, and looking at those reforms now, starting, for example, in Nigeria with our National Health Act, health policies and plans that have been developed, some health financing reforms like the Basic Healthcare Provision Fund, the very recent decentralized social health insurance program. Nigeria even has an action plan for UHC, for instance. There's and you know, some of these policies. So they are good entry points for someone who wants to start asking the right questions, maybe not really the right questions, but asking questions that align with what policymakers and practitioners would actually find relevant if eventually research evidence is generated from those questions. I mean, so we need to look at what reforms are already taking place, and then what kind of questions can we ask based on those reforms that policymakers and implementers, program managers, and all of that they would find useful in making their decisions, daily decisions, and even improving policy and practice. So, I mean, I think that's one. And it's also important for me to highlight that Nigeria actually has a health research policy and priority, you know, a document that also highlights what Nigeria's health research priorities are. And in that document, there's a place too for health policy and systems research. You know, it's highlighted there, capacity strengthening for health policy and systems research, but also the areas of health policy and systems research that the country is interested in. And that's a place, you know, for us researchers to start asking research questions from, and all of that. Then for the policy makers, for instance, I mean, Prof also mentioned about the research, I think he used the word comatose, the comatose research components of the Directorate for Planning, Research and Statistics in the Ministries of Health. I mean, reactivating the research components of the DPRS at the federal and state levels of Ministry of Health will create, you know, very good entry points, you know, so that even the policymakers already, or the decision makers in the Ministry of Health, are already thinking about, you know, research and how to use research to improve program planning, to improve policy making, and all of that. Then for both researchers and policymakers, he also highlighted, and I think Gafar also highlighted researcher embeddedness, you know, being embedded in the policy making process. And there's this example that I want to share with us. You know, there's this very common thing that happens every month in all states, I think every state in Nigeria. The LGA Health Authority secretaries meet on a monthly basis with people from the Ministry of Health to present their data and to share, you know, find what experiences and all of that. I've never been in one of those meetings, but I think that's also maybe an entry point. It's a place to start. It's a place to start generating. It's a potential place for researchers to begin to generate questions that would be relevant for policy and practice. I mean, just simply attending those meetings, listening to what they say, listening to the problems that are arising from implementation in the field, and then taking it up and doing research on it, and then generating evidence that could improve practice for them and all of that. And there's also the an opportunity we have, for instance, the trainers, you know, in our training institutions, for example, we attract our postgraduate programs often attract people who are involved in policy making and practice and program management and all of that. And that's a good place also for us trainers to also start thinking about and engaging them in policy relevant research, or even trying to understand what the policy concerns are, even at that point. Then finally, just to highlight that knowledge brokering, you know, is also very important. I mean, we need to be working with intermediaries, researchers, even policymakers. I think Prof also highlighted that liaison thing, but also intentionally, researchers, we are programmed to do science, you know, to just generate evidence. And it takes a while to learn even how to communicate and how to be speaking the language of policymakers, or even identifying what their needs, policy needs are. But there are these knowledge brokers that we can work with. And that's an experience we've had in HPRG also, working with someone who is an intermediary, who is helping to strengthen relationships, helping to strengthen networks, helping to source for knowledge for policymakers, and then communicate to the researchers also what the interests of policymakers are. So thank you, Felix. Let me stop here and. Yeah. Felix, can you unmute yourself?
All right, great. Sorry, I was muted. Thanks, Chinyere, for that. I will still come back to the issue of capacity and skills building, because I think it's an important thing. But before that, we have somebody who is an ethicist in our midst, and Dr. Cheluchi. I know it's an interesting thing because just a few months ago, I think it's not, I wouldn't say months in the sense of months, there was an issue that regarding decolonization of health policy, and where we had a lot of a major researcher in US that had to retract a paper that was published and is based on a research base that was supposedly conducted in Nigeria. So my question to Cheluchi is along this line. So what have been your experience in upholding ethical conduct of research, and what are the major ethical concerns you have, or that we should be highlighting in terms of conducting health policy and system research in Nigeria? And if there are gaps, what do you think are the steps and entry points for ensuring that ethical conduct is maintained while conducting research and publication in Nigeria?
Thank you, Felix. It's a pleasure to be here. Thank you for the invitation. It's been a pleasure also to listen to some of the presentations. Very nice seeing you again, Prof. And that was, I mean, that presentation, that lead presentation really sets a fantastic foundation for our conversation. Thank you, Felix, for that question. You are part of us at the National Health Research Ethics Committee, so you have the sense of, I'm sure you have the answers to some of the questions that you asked me, but I'm just going to lay them out for the benefit of others that are with us. Sure. As we discuss the interplay between policymaking and research, it's important to also ensure that the research that we're hoping will inform policy is done in an ethical way. It's done respecting key ethical principles around autonomy, around not doing any harm, around doing good, so beneficence, and around making an actual contribution to policy, in the space that we're working. Okay, and as Felix rightly pointed out, working with the National Health Research Ethics Committee, we've come across different things that have happened over time. We talk about things like decolonization, and that's something that is really still very much present with us. So even though typically when we think about ethics, we think in terms of some of these principles that I've mentioned, I think that we also have to think in terms of funding. When you don't fund yourself, when you don't fund your research, you more or less lay yourself open to different risks. And that's what we are finding. We lay ourselves open to risks that we know about, where there can be exploitation of the research people who participate in the research, but you also lay yourself open to what Dr. Mbachu referred to in terms of prioritization. What kinds of research are we even conducting? I think that's one of the first things to consider, and that's, I think, something that's really germane to policy making. We have the health research and policy and priorities, which you referred to. I don't know that many people are even aware of that policy. So and it's such an interesting policy because it's wide ranging and it contains things around HSPR. But we have all this, we have many people, donors, and other kinds of development partners who fund all kinds of research, and that's not bad. I'm just saying that we make all of these policies and then we don't apply them. Okay, we don't put them into practice. So first of all, this is a conversation. If you look at that policy, you will realize that this is a conversation that we have had time and time again. It is now time for implementation. So that's my first key ethical question. Okay, are we taking charge of our own research? Are we taking charge of the priorities that we have set out? Are those priorities aligned with the policy priorities? Okay, and I'm throwing that out as a question because I wish I could just tell you the answer to that, but those are the things that we need to have that mind to. In terms of other implications, one of those things that we found was people come in, they do research that is aligned to policy, go in, find out, for example, the uptake of EHR in health facilities across the country, find out the uptake of telemedicine or immunization or whatever it is, and they get all kinds of data. And then they go off and sometimes they write up things that do not even involve Nigerians. I think even for policymakers, that's a place to begin to focus when you talk about ethics. So not just ethics at that level of the researcher stroke research participant, but just more globally, more holistically, in terms of us as a country, where we see ourselves in terms of the research that we do, because all of that there is that interplay, of course, between that policy and research in that respect. Okay, in terms of HSPR, I think also it's important to, sometimes we do these pieces of research and I read different things, and you can see that there are issues that must have raised research ethics issue, and it's not quite clear that these things have gone through research ethics review. There are all kinds of things that we can unbundle around that, around the fact that we need to do a little more monitoring and so on and so forth. But these are some of the ethical issues. So let me just stop there for a bit and go on to the other things that I wanted to say. In terms of,
maybe, sorry, excuse me, maybe if you just hold on. If you just hold on, we'll come back to ethics later. Let's just,
all right.
You mentioned the issue of funding, and that brings us to the conversation around sustainability and all. So we know that funding is an issue, but maybe we'll look at it both from the academic side in terms of research, but also from the program side. So we have, Gafar has been a program manager. I know he's done a lot of, managed a couple of programs. Professor Eche has done a lot of research that more like implementation research. And Professor Obi, I just want the three of you, Professor Obinna, Professor Eche, and Dr. Gafar, to just in like 2 minutes, can you give us an idea of how we can leverage, for instance, the programs, the HIV/AIDS, the maternal and child health, all those sort of programs? I know they present us opportunities for funding research, especially policy relevant research. But one, are we using them enough? Are we leveraging enough of these resources to build capacity, to generate evidence and ensure that programs are more efficient and effective? Maybe from your experience, and if not, how can we make sure that, one, we are utilizing those and also ensuring that research funding and is sustainable, whether through existing programs, whether it's funded by government or not. I know Professor, for instance, is a director of research in UNN. So Prof. Obinna, you can start, then Professor Eche, and then Gafar. Just 2 minutes, please. Hello, Prof. You can unmute yourself. I'm unmuted. Okay. Yeah, maybe volume, a little more volume.
Is it better?
Yes, it is.
Is it better?
Yes, it's better now.
Okay, it's better.
Yes.
Yeah, so the issue of funding of research, I mean, until we have you know, real sustainable public funding of research, that, you know, which happens in most other countries, even Ghana here, you know, they have research centers that are well funded for research. We need a Nigerian MRC, equivalent of a Medical Research Council, others that will fund research, but not just research. I mean, here, remember our focus here is putting money in epidemiology and all that. We are talking about health policy and system research. So I think the interest, you need to generate interest among the chief executives on the relevance and usefulness of health policy and system research, and for them to put money. You know, once people need to move away from faith-based policymaking to evidence-based, and then once they know, you know, the interest on health policy and system research, that will, you know, gives the evidence on how to actually improve that things work. So the interest has to be there first. So how do we need to generate the interest? And then we'll talk about the money. I mean, those days that I was helping the Minister of Health to develop medium-term sector strategies and the budget. I mean, we started highlighting research. In fact, you know, Professor Lambo's health sector reform program, we added research as one of the building blocks for the Nigerian health system in 2005 or something like that, 2004. Because we recognize that if you don't highlight research, no, you won't have funding, because then funding was along the lines of the building blocks. So we said, well, we have to put research as one of building blocks of Nigerian health system. So right now, research is now one of the building blocks of our health system. So we need to further, you know, get people to be interested in research, and that R will have to, does have to be comatose again. Because I mean, I keep saying, without research, without health policy and system research to improve on what we are doing, we will not achieve anything called UAC or SDG. So we need that interest and sustainable systems. Thank you very much.
All right. So thanks, Prof. So, Professor, yeah, you can now respond, sir.
Yeah, well, thank you so much. You know, there are things that are old sayings that stay true for a long period of time. And one of the old saying is that he who pays the piper detects the tune. So if people pay your research, I will give you an example. I used to, when I started my career, I used to do clinical trials. And one of the things about clinical trials is that they bring in the protocol for me, and then I recruit patients. And after a while, it was no longer satisfying to me, because I wanted to be part of developing the protocol. I just didn't want to be recruiting the patient that will follow the protocol. And in order to do that, that means I have to find my own funding, because it's those who have the funding that develop the protocol, right? I was just recruiting patients, even though I was participating in the research. So I started competing for my own grants. And that's how I started competing for my own grants. Why do I say that? I spent time at the, as the executive director for the National Primary Care Agency. And one of the first things that shocked me is that I wanted to find the data for immunization in Nigeria. And I found out that I couldn't get it from Nigerian government. I can only get it from WHO. WHO, of course, supports a lot of those programs in Nigeria, and they want to hold those things to make sure the integrity, to make sure those things are kept very well. But this is, I'm talking about data for Nigeria. And I was executive director for the National Primary Care Agency, and that data can only be gotten from WHO. Why do I say that? That is not to say anything bad about WHO, is to say anything bad, something, if anything, to say about our government, not taking ownership, not taking, that's something we say, he who pays the piper. If we don't pay for our research, how do we control the data that is generated from them? Someone in the audience asks a question that he can do systematic review, but he doesn't have access to the data. Well, the data doesn't belong to Nigeria. If you want to get a data on HIV, you're not going to get it from any of the implementing partners. You have to get it from CDC, the USAID, the Global Fund, and rightly so, they fund all of those projects. So one of the things we have to think about was, how do we fund our own data that generate the evidence we need for our policy making? And one of the things I thought Nigeria did very well was the TED Fund. The TED Fund to me was the beginning of the MRC, the beginning of the NIH, the beginning of those big funding. But then the TED Fund has to tie to the document that have been mentioned, which is the policy priorities of Nigeria, the research priorities of Nigeria. But I did a look at the things that TED Fund was funding. It has no relationship to the things that were in the research priorities. So if Nigeria in its own funding is not even following their own research priority, this is the money, TED Fund, Nigeria money, that they are funding research, but they are not using the Nigeria identified research priority. Come on. So you see the problem. One of them is that we have to tie these things together. The TED Fund is our attempt to fund our research. The Nigerian priority is our attempt to own the priorities of our research. Those two things has to be tied together. TED Fund should not be funding things that are not on Nigerian research priority identified. They should make them, and if they think the identified priority that they have is not good, do a new one, so that you are funding the things that are priorities in Nigeria that the NIH in the US may not fund, the MRC in Europe may not fund, but Nigeria can fund. So they have to tie to our own priority. And I think that's one of the ways we can change some of the dynamics, where we are funding those things that are peculiar and needed for us. If I send a grant, then I hit and I say, this is going to be good for Nigeria, I will not get that funding. The only way I get funding is to say, I am using Nigeria as a test ground, but what I find out can be adaptable to every low and middle income country. So generalizability, I have to be able to demonstrate that even though I'm doing this in Nigeria, that they can be generalized to other countries. But there are certain things that are not generalized to other countries that are specific to Nigeria, and Nigeria should be funding those things. And some of them is the things that are specific to our health policy research. Because our health policy research cannot be generalized. There is no country that picks their president by rotating them. Whether they go to the northeast, north, south, we are unique in our way. There's no somebody that does federal character that every minister has to come from one particular place, whether they know how to use research or not. These things are unique to Nigeria. So there are certain things that only Nigeria can fund, because nobody will be interested in funding that. But they're important to Nigeria because of our system. So I think we have to align our funding, which in this case we do have, to the TED funding, I may be wrong, to those documents that have Nigerian research priorities identified. I will stop here.
All right, thanks, Prof. So Dr. Gafar, you've seen both professors are obviously based in university settings and research settings. Now you've been in the midst of more of policy, environment, and program. So how do we situate this issue of sustainability of research through programs? I know that at least Ministry of Health gets budget every year. MPHCDA gets budget, NHIS, and all that. So how do we institutionalize the generation and use of health policy and system research in programming? Maybe the next 2 minutes, please.
Okay, thank you very much.
We'll come back to you, Cheluchi, after this.
Okay, thank you very much, Felix. So listening to the two professors and looking at what is obtainable, I think there are two important mainstreams of funding research. One, of course, which is more sustainable, is to use a government money, which is more sustainable. You are likely to fund your own priority research agenda if you use your money. That is well known. But we're in the context where, of course, we are not yet there in terms of making a very strong case for research to be prioritized. But it could be done. Like, for example, like I said earlier on, this thing is more political than technical. And we have to increase the political appetite for use of our research for decision making. And it is when the the political class prioritize it, that is when they are going to put money. But in the meantime, what are the opportunities that we can leverage before we get government to be more interested and spending money on research? There are a lot of things happening, but unfortunately, we have not formed that coalition to really harness and align existing resources to improve the research environment. What am I saying? There are a number of our programs, with the DFID, USAID, that they do a lot of things. They are doing a lot of research work. For example, Lafayette DFID is doing a lot of political economy analysis, governance assessment, fiscal space assessment. But who owns these things? It's the program that owns it, because government is here to demonstrate that, okay, this is my research agenda, and this is what you are doing, feed into the research agenda. So the first thing we need to do to harness the existing resources where we are still struggling to get government to spend more money. What is the existing opportunity? What are the low-hanging fruits that we can harness? And that is what I'm talking about, this coalition building between the researcher, the policymaker, people in the program, and led by a very strong Department of Planning, Research and Statistics that is able to develop a research agenda. So when the research agenda is developed, whether with government money or what the donors are doing, they look at the research agenda and they pick their research topics there. And whatever they do, they're already contributing to the research environment. Another thing is that even those people that are coming from abroad, there are a lot of institutions that want to come and do something in Nigeria. And I will give you a specific example. Like 10 years back, the malaria project, SOMAP, developed a research agenda for malaria that identify a number of research topics. That was a very, very useful instrument, because beyond the shores of this country, a lot of people key into it. They came to Nigeria and they aligned with that research agenda. And again, the fact that we say a lot of time that we don't have data, But there are we have some data banks that nobody is tapping into. We have a NDHA demographic and health survey. There's a lot of useful material. How many publications have we seen in Nigeria from this available data? So we really need to form a coalition, look at what are the available opportunities, how do we leverage them, so that we'll not continue to say until government is putting in money. So we should try as much as possible to leverage the existing environment as much as possible. Somebody says if donors is paying, do not take ownership. It's because we have not really keyed into the principles and policy of aid effectiveness. We are in the era of development cooperation, no longer in the era of donor. Development cooperation in the sense that both the so-called donor and recipient sit down at the table and dialogue and say, this is my priority. It is happening in a number of smaller African countries. So I think we just need to come together to form a strong coalition. Professor Obinna did something very well recently. He opened an online platform where a lot of people are discussing policy issues on health economics. We can expand such platform to policy makers as well, to people in development, so that from time to time we have a clear agenda, we come together to set up a clear agenda. But my main point here is that while we are waiting for government to put in more money into research. We have to try as much as possible, look at existing opportunities and leverage them as much as possible. Thank you.
All right, thanks, Dr. Gafar. I remember the implementation research agenda for malaria, and interestingly, I think it was last year that there was a meeting in Abuja which Professor Obinna and we attended, where it was revised actually. So I think if other programs can have a very clear research agenda, implementation of question research agenda that is policy relevant, I think that's also one way. I know we didn't finish up with Cheluchi. We'll go back to Cheluchi to wrap up on ethics, but we'll come back to issues around the capacity building because we didn't quite trash that, and that may be one of the last issues we'll trash. So Cheluchi, there's this question from Adeinka. So says you mentioned the need to reduce risk of exploitation during research. So the interest is, how do we understand what sort of risks and ethical concerns that are being overlooked in health policy and systems research? And if we recognize those gaps, how can we mitigate against them or close the gap? So maybe list the specific things that we need to be wary of, or at least be both policymakers and research community in Nigeria need to be aware of, and then how can we address them?
Thank you very much, Felix. I won't take our time. I see we're really running quite quickly. I think first of all, for those involved in HSPR, I think it's very important to determine whether or not you're doing research. And of course, we know that there can be issues where we're looking at quality improvement, where we're not quite clear. Once we're not clear, I think the very first thing to do is to ensure that we submit such proposals to for research ethics review. Yes, we do have problems about overreach by some of the ethics review committees, but we will get there. It's one step at a time. So first of all, determine, are we doing research? Are we doing practice? Are we doing both? And can we segregate the research component and make sure it goes through research ethics review? We have a national code on health research ethics in Nigeria. I think all of us should be aware of that. We should go through that, see if what we're doing at any time is research. Sometimes we're interviewing policymakers. We should be able to figure out whether or not that is research by going through that code. I'm not going to go into explicit detail about that. There's no time for that, but I would encourage us to have a look at that because it does dissect some of those issues. Very importantly, bearing in mind conflict of interest. I think conflict of interest is one ethical issue that is very prominent when we talk about HSPR. We've talked a lot about researchers, simplifying research in such a way that policymakers can understand them, creating forums where they can meet with policy makers. There is always that possibility of agenda-driven research based on all of this. So these are all things that we have to bear in mind and try to mitigate by taking steps to submit our research to review, taking steps to ensure our objectivity, or by clearly highlighting our biases and so on and so forth. That also applies, of course, depending on where we're getting our funding from. I think the last thing I would say is just something about just being aware that ethics is important. There's a lot of, we have a lot of problems. We can get carried away. But being aware that if we don't, we're not very interested in ethics, what we risk making nonsense of the whole research enterprise. We risk taking away trust in the research enterprise. And that, of course, destroys the foundations of what we're trying to accomplish, which is that research will inform policy and we can trust that research is good enough and strong enough and based on the right premises and principles. Okay, I think I'll leave it at that.
All right, yeah, thanks, Cheluchi. I think I just want to, maybe the next few minutes, I would like to ask not just necessarily the professors here, but in terms of health policy and systems research, what are the specific skills that will be more relevant to our context, especially in Nigeria, since Nigeria is our frame for today, but or especially Nigeria, for instance, what specific skills do we need, one, among researchers, maybe who are based in universities, and then researchers who are based within public sector institutions like Ministry of Health and the agencies? What sort of key specific research skills do they need to ensure that they're able to generate the research and then be able to translate it for use? Let me start with Professor Obinna. Just one minute. Chinyere, Gafar, Cheluchi, all the panelists, just one minute each. Can you just highlight specific skills you think we need? And then after that, the next thing we'll discuss is about how to disseminate the evidence and socializing it. We can start with Professor Obinna. Just one minute.
I'll allow Eche to answer this one.
Okay,
what I want to say, I want to talk about how do we build the capacity, which I think is quite important. So I think this, we are talking about how do we build capacity of the policymakers or decision makers, and how do we build the capacity of the researchers. So for the policymakers and decision makers, that's where I see something that can involve the Health Reform Foundation. To develop, programs, training programs with policymakers, so that part of what, to another extent, the Health Sector Reform Coalition is to actually, take up this challenge of building the capacity of the policymakers and decision makers on health policy and system research through maybe short courses, through webinars, through other innovative methods. So I think that's why it's quite important. They will now talk about how do we now build the capacity of the researchers. I mean, the interest has to be there, and capacity can be built in several ways. One, through formal education, more masters, PhDs, postgraduate diplomas, and even, I don't even see why you can't even have a bachelor degrees in relevant areas, in health admin and management. So that to catch them early. So I think we need to catch them early, and then I mean, this where also we can also have short courses to build a capacity of researchers. And this capacity is not just on those skills, those research skills, but also the skills of getting research into policy and practice. Same way, the skills that we build for the policymakers is not just to understand health policy and system research, but also to know how to distill such evidence and use them for decision making. So I think, so for me, that's quite important. So those are the rules. And then we also expect to see, because part of our problem is that the Nigerian Institute of Medical Research has been mostly biomedical, unlike what we get in other countries where such medical research, like NIMA, they do a lot of health policy and system research. So NIMA has a role as a primary research institute in health to create a very big department and program on health policy and system research. Because I think NIMA focuses too much on biomedical and all that. That's a negative. Why we're not getting a lot of HPSR into what we're doing. But government funding must be there. I mean, we know what happens in countries like Ghana. So many research institutes, almost 5, 6, funded by governments, produce evidence that they need for decision making. I don't want to mention Thailand. You know a lot about Thailand, where government is actually funding the health policy program. Government created a health policy program and just funds them to generate evidence that will inform whatever decision that is taken in Thailand. I don't want to mention America. That's why I'm taking, these countries, that are our peers. So we need to get, we need to get a real plan. And like Cheluchi mentioned, a lot of those plans are actually in that National Health Research Policy, but who has seen the National Health Research Policy and priorities? We also need to promote that document. Thank you very much.
All right, thanks, Prof. So, Professor Eche, can you just quickly highlight key skills and how to build that, but especially the key skills that are needed in HPSR?
I don't know that. Thank you so much. I'm not sure if I will get an opportunity to talk about this, but there are three things I really do want to talk about, not just about the skills, about things that needs to, what the problems are, but I really want to talk about just three things that are potential solutions in terms of the skill acquisition. So I was an associate professor at the University of Nevada when the Robert Wood Johnson Health Policy Fellowship is a fellowship that is endowed by the Robert Wood Johnson Foundation. So I was just thinking about the Health Reform Foundation, what they can do. And what they did, that they go around and they select about 6 individuals. One of the most competitive interview I've gone to. And I was selected as one of the Robert Wood Johnson Health Policy Fellows. And I spent a whole year with the Secretary for Health in the US. Then it was Kathleen Sebelius. So imagine you being an institution researcher in one of universities, the University of Jos, and then you are selected by this foundation and they support your sabbatical. So this is how we can utilize these things. So there is a sabbatical that institutions have. And then they send me there for 1 year to spend the time with the Minister for Health, and then be able to bring in the research, bring out some of those things into the policy making. Again, some of the things we are talking about embedding researchers into policy making. That is one of the ways we could do that, where we could have a way to support those sabbaticals, not so that they go to the US, to Canada, but actually to spend time, those researchers in our policy making institutions, either in the Ministry of Health, in the state ministries, in the federal ministries, in the commissioner's office, and things like that. The second one is the things we can do with postdoctoral mentorship, so that when people finish their PhDs and come back to Nigeria, there is a way we match them to mentors in the country where they can have a year or two where they can actually practice in things that they do. Mentorship is the thing that is going to get us in this place. We have people who are already experienced enough to do that. The last thing that I want to be able to talk about is what I call shared faculties. So, for example, people who are in academia know that already. So let me take an example. I am a faculty at the University of Nigeria. So my salary comes from the University of Nigeria, which is the Ministry of Education. The other part of my salary comes from the University of Nigerian Teaching Hospital, which is the Ministry of Health. The other part of my salary comes from IHVN, which is a program in the town. So I have these 3 people pay my salary, which allows me to do what? To do teaching, which allows me to do what? Do research, which allows me to do what? Policy and practice. So when we can start doing a way where people are not only in institutions, where they're in university, but some of their salary can also be paid by programs and can also be paid by the government in terms of policy. So someone like Prof. Onwujekwe doesn't have to be paid only by the University of Nigeria. Part of his salary can be paid as an advisor to the Ministry of Health, for example. And I'm not saying more money to the salary, I'm just saying their salary is shared in a way that their responsibility can be adapted. So they're still in the university, they don't have to leave their university to become the government employee, in the politics, but they can still share their expertise with the government in their policy making. I will stop here.
Well, thanks so much, Prof. This is, thanks so much. I think that issue of embedding researchers within government. Just a quick information. So one of our researchers, Professor Chinyere Mbachu, I don't know if he's on this webinar. He's been with of course, Prof, he was supposed to work with you, or he started working with you at HPSR and all. But I think being a researcher at HPRG, University of Nigeria, they moved over to MPSCDA. During our interactions, I think he has come to understand all the nuances of policy making and the political economy and the realities of translating research. Within the public sector, is a very dynamic place where research has to be as fast, the evidence, for it to fit into what they are doing. So I think if you have advisors within, they understand research, they understand evidence generation, and they know how to get that into policy, I think is a good experience. I know we don't have so much time left, but one area I wanted us to discuss now is, so if we have all this evidence, both from the research side and those within public sector, what sort of platforms are available? I'm not talking about conferences now. I'm not talking about journal papers, but how best can we share this evidence in a way that the people who need them, both policymakers, program people, can have that. So Chinyere, I would like you to respond. And also Dr. Gafar, I will also want you to respond from the perspective of the joint learning experience, whether legislative network, joint learning, the NGLN, he will explain that. Maybe use that as what sort of forum that we can use for sharing evidence, Nigerian Governors Forum and all of that. Maybe it would be good to just elucidate a bit on that. But Chinyere, I would like you to start based on the experience from HPRG and others we've worked with.
Okay, thank you very much, Felix. Yeah, so I'm going to be basically just sharing from experience of what we've done in HPRG, how we've engaged policymakers through evidence, sharing evidence with them. Okay, so we intentionally produce policy briefs, short policy briefs, 2-page policy briefs, and these policy briefs basically highlight key findings and the way forward. Okay, so unlike the academic articles and manuscripts that are a lot on methodology, on findings and discussions and all of that, the policy briefs are, very, very short and very highly informative about way forward, making clear recommendations, because our understanding and from my experience is that the policymakers, they want to see actions, like actionable points. So what next? What then do we do? So the policy briefs one, and then we've also explored blogs recently, and then tweeting evidence. So there's also this work we did with maternal and child health, realist evaluation of maternal and child health interventions in Nigeria, and the evidence was converted into I think a 2-minute video, just sharing the key findings and also recommendations in that 2-minute video, very short, quick, and then you still get to deliver your message through that approach. Then just to share, an experience, a personal experience that I had recently in an implementation research project that we're conducting in one of the southeast states in Nigeria. So we started with stakeholder engagement, which is a key skill that every health policy and systems researcher needs to know, because collaborative partnership with the policymakers and the communities that the research is going to happen is an ethical thing that is very distinct or unique to health policy and systems research. So we started with engaging policymakers and then engage them through designing the strategies for implementing the interventions and all of that. And along the line, I had this comment from one of our boundary partners, the people that actually designed the interventions with us and all of that. A comment that this is going to be dead on arrival, that kind of thing. That something we had designed, we thought out, as researchers, we had thought this is the best way to, present this thing. And then we got this feedback that this is dead on arrival. So we had to go back and sit down again and start to renegotiate relationships and also renegotiate, how we communicate our findings and how do we put it in the language that is not dead on arrival and that kind of thing. So, I mean, I'll just stop there and just highlighting policy briefs and tweeting and using videos and being innovative about how we share evidence.
All right, thanks, Chinyere.
I just comment, Felix.
Okay,
sorry, let me just add one more. Policy dialogue. Remember last time we had a policy dialogue in Abuja. Gafar was there, where we presented not just our evidence, but even evidence of other key people like Gafar's organization, and so we brought policymakers and researchers together. And we sat over 2 days to look at a lot of evidence not just from HPRG, but from Gafar had a lot from what they did in Lagos State. So that policy dialogue also helps to jointly look at such evidence and decide jointly how they can be taken into policy and practice. Okay, thank you. All
right, thanks, Prof. So, Gafar, please, maybe you just share the experience from NGLN, Legislative Network, how the Nigerian Governors Forum uses scorecards and all of that, because they are platforms where evidence can also be used to reach policymakers.
It's okay. Oh, thank you very much. I think the first thing I would like to say with regards to engaging the political class while disseminating evidence is we have to think and work politically and understand what the political class, what they are sensitive to while presenting our evidence. So I will use the example of engaging the Nigerian Governors Forum. So, you know, they tell us that Nigerian Governors Forum, the attention span of the governors is very, very short, and they're not able to listen to very short, long presentation. Even what you call a brief might be too long for them when you are engaging with them. So we now discover that they are very, very sensitive to comparison when we are comparing states, especially when you use color codes. So they are very, very sensitive to that, and we'll be able to push a number of things by creating a scorecard that rates the performance and shows in terms of red or green, in terms of how you perform. And a number of states have seen red on their scorecard for state health insurance scheme, for instance, and because of that, they went back home and asked their policymakers, why am I performing this way? And they said it's because you did not put money for this and all those stuff. So we have to think and work politically when engaging the political class. We've seen that at the level of legislative network as well. The lawmakers themselves, they are very, very sensitive to data that compare them with other constituencies, you know, because it's very, very political, and a number of lawmakers have approach us again and say, where's the source of that data? What do you want me to do? I will do this so that I'll look better next time when we are presenting this. So I think what I'm saying, not sure, the Prof has talked about at the level of the policymaker when we are presenting this. But what it is very, very important for us to know how to engage the political class as well. You know, the policy makers, it's very, very easy to convert them, and they will understand that, yes, it is good for us to follow politics. But it is the political class that determine the flow of fund. So we really have to know and incorporate it as part of our learning agenda and our research agenda as well, in terms of how to engage the political class and how to communicate effectively. But what we know is that the political class in Nigeria, they are very, very sensitive to comparison, especially if some states are performing well and others are not. It is a different thing for all of them are not performing. So I would like to stop here.
All right, thanks. And we just have a few more minutes to round off. And it's been I wish we have like the whole night to discuss. We have any, let me say, other co-organizers, do we have any specific question that we, maybe a burning one that we will need to tackle? But before we finish, Prof, the two Profs, you spoke a lot about mentorship, and I've seen some comments in the chat box about mentorship. I would like you to, I know both of you have mentored people in this area. So what are the essentials that, if, for instance, some participant here who wants to be mentored and he's somewhere far away from you, how can that be done? Maybe just two of you quickly, what are the key things and how can we ensure that the mentorship is done? And then the last question before we just round up would be to Cheluchi or any other person can respond. Issues around accountability with respect to research. I know we do accountability and in other aspects, we want to hold government accountable for budget, but in the area of research, how do we make sure that we protect the research community in Nigeria from exploitation from the West? I'm using exploitation broadly, but within the framework of decolonization. So Prof, the two Profs, please just quick points on mentorship with respect to health policy assistance research.
So mentorship starts with interest. I mean, the mentee has to be interested, and so it's a two-way thing. The mentee has to be interested and indicate interest, and be ready to work hard. You know, we have a lot of people coming and say, "Oh, I want to be mentored," and then just one very small assignment and the person disappears. So they should know it's a learning process, and the person has to be calm and be ready to learn, you know, and to obey instructions. But the important thing is that interest has to be there. So if I give you an example, just yesterday, last week, a lady called me. I want to learn how to write, and if we use policies, you know, write, communicate. So, and then I said, okay, can you come to Enugu? Do you know this lady came to Enugu? And we discussed, and then she brought some things she's doing. And then I showed her policy briefs and guided her about how to work. She doesn't live in Enugu, you know, but we've now decided how we'll be communicating through emails and telephone. And then if there's something happening jointly where she lives or she's in town, then we can collaborate or she can participate. So, but the important thing is interest and patience and discipline. So many people that want to be mentored, they lack patience, they lack discipline. So once you have those two ingredients, then you're ready. And then I think, I mean, HM mentors people from America, you know, but if you give an instruction and say there's a deadline, you have to meet the deadline. You know, that's the important thing. So I think it's quite important. The mentors are always happy to get serious-minded mentees in this area. Okay, thank you.
All right, thanks. Professor Che, you can if you have something to add.
He really said a great thing about what is required, because in Nigeria, I think people think that what is lacking is mentors. I think what is lacking is good mentees. And people will challenge me to that, and I will challenge them and say, if you think you're a good mentee, give them my phone number, give them my email, and if I fail them, then they should come back to this meeting and tell you. What we lack in Nigeria is good mentees, not good mentors. People will challenge me to that, and I will challenge them back. And one of the things is that I have a 48-minute rule, we have a 48 hours rule. If I send you an email and it takes you a week to return, I will not work with you. The reason is that you do not understand what my time means. You do not understand, because when you're asking me to mentor you, you are not paying me. I am taking my time, and that time values to me. And if I send you an email, can you send me your bio sketch? And I don't hear anything from you, and after 1 week, you send me your bio sketch. Maybe your mother is in the hospital, maybe your husband is in the hospital, but there no communications means no interest. It's okay to say, thank you, Prof, for asking for my mentee. My mother just got admitted today. Can I send this to you next week? And my answer would be yes, because I understand you have to take care of your mother. But if you just waited on Friday, you send it to me, and sorry, I'm submitting this late because my mother was in the hospital. I don't believe you. So again, to somebody looking for a good, they say if you want to be a good, you have to be a good follower too. If you want to be someone to mentor you, if you want me to spend my time to mentor you, please show me that you're serious as a good mentee. So first of all, ask what is a good mentee. When you find that out, I think you'll find a good mentor.
All right, thank you so much. Maybe Cheluchi, just in the next few minutes, can you just respond to the issue around accountability with respect to research and also protection of the, I don't want to just say rights, but researchers in low and medium income countries, or where there is this power imbalance between maybe primary PIs, principal investigators who are across the continent and those within our country. So what should a local researcher know, and in terms of their relationship with other, maybe those who are funding from outside? I mean, are there ways we can manage that dynamics before we round up?
Okay, I think that in terms of accountability, it should be a bottom-up thing. So usually we think about accountability and we think about governments and so on and so forth, but accountability starts with each of us. Accountability starts with an individual researcher deciding to do things with integrity, deciding to follow the research protocol that he has submitted and which has been approved, and so on and so forth. As you know from our experience from some of the things that we have seen, especially in recent times, sometimes you even dig in and you find out that things that have been published have not even, the basic research has not taken place. So, and of course we have issues around quality, around plagiarism, and all of those kinds of things. Those are individual things that we must take care of. Or at an institutional level, every institution has a health, at least all universities ought to have a health research ethics committee according to the National Health Act. And those health research ethics committees need to be properly resourced, provided for, so that they can do their work without fear of favor. The same thing really needs to apply at the national level as well. And each of these committees then need to do their work. You know, we can play nice about it and speak long grammar, but that is the bottom line. We have to resource these organizations or institutions, and we have to then allow them to do the work that they have been chosen to do. What was the second question? The second arm of the question was related to what? Felix, remind me.
Yes, we're talking about protecting the,
yes,
I don't want to just say rights of local, but
yes,
for them to know in terms of power dynamics here.
Yeah, it's, I mean, we've sort of talked about it. Everybody has sort of mentioned it. I think the most important way to protect local researchers is to fund research. I think there's just no getting away from that. There is also, I know that internationally, there's push towards ensuring that sometimes PIs come from the countries in which the grants are going to be implemented and so on. Those are international things that are now being pushed, or that there needs to be, you know, co-PIs, one from the south and one from the north. Those are also things that are currently being pushed. Some of these things are also things that we need to now also implement in our policies. So for Nigeria, for example, I would say we also need to go back to our national code and beef up those kinds of things. In terms of publications, who should be the first, which should we have local people involved in the publication one? Should they be listed as authors? Can they be listed as first authors? Those are all things that we need to begin to think about. We need to have our own databases. We need to have our own reputable journals. Just no getting away from some of these things. These are the things that will change the dynamic and change all the narrative around exploitation of local researchers and colonialism and recolonialism and so on.
All right, thanks. I know we are just at the top of the hour, and yeah, I'm sorry. I wish we can add one more hour, but this is already 7 p.m. in Nigeria, so we just have to wrap up now. We want to thank everyone that participated. We had over 100 participants who signed up, and of course, everyone who joined, the panelists. We want to thank everyone, Professor Obinna, Professor Eche, Dr. Gafar, Dr. Chinyere, Dr. Cheluchi, and everyone. We want to thank you. I want to now hand over to the organizer to wrap up. Kasarach, please.
Oh, thank you very much, Felix, and thank you, Prof. Echezona, Prof. Obinna, Dr. Cheluchi, Dr. Chinyere, and Dr. Gafar for stimulating these wonderful conversations. And we know that these conversations are not going to end here. This is just the beginning of a journey. We're really glad that you honored our invitation, and we would be reaching out to you subsequently. And to our participants, just to say that we have another session tomorrow morning. Our session 3A and B is for tomorrow. So we kindly urge you to log in and to say that what you've seen today, tomorrow is going to be better than what we've had today. So thank you very much to everybody that has joined. We're gathering steam, and we believe that these conversations, like I said, are going to lead to something greater. Thank you, and over.
All right, thanks. Just a tip. Kasarach, you didn't tell them that the minister is also going to speak. My sister, why now? And Bishop Kuka. So we have something packed here. Please talk about it a bit.
Okay, so let me just briefly talk about tomorrow's panel. And we will have the Minister of State for Health on tomorrow's panel. We'll also have Bishop Kuka on tomorrow's panel. And that's why I said the panel promises to be very engaging. So we implore everybody to join tomorrow to hear what we have to say tomorrow. Thank you very much.
All right, thanks everyone. Have a good evening.
And the time for tomorrow is 10 a.m. please.
Okay.
Check your emails for the login details. If you have any issue, we'll be there to support you by sending a response or question to the email in the email you get, your login email. Thank you.
Okay, just
you,
just one last thing. Some people asked for the presentation by Professor Obinna, or if there are other resources, please just take note of that in case we need to share with all participants. Yes.
All right. Thank you all.
Okay.
The presentation and other materials will be shared with all the registered participants. Yeah. Thank you. Okay. Enjoy your evening. Bye.
Bye.
Thank you.